Uterine fibroids are growths within your uterus that are not cancer, and they can never become cancer. These are very vascular structures that grow within the uterus, and because they're vascular, every time a woman has a menstrual cycle, it causes heavy bleeding and is also associated with severe pain and discomfort. Most women, when they're diagnosed with uterine fibroids, their gynecologist offers them two primary options: one, hysterectomy, and two, myomectomy. But there's a third option, which is a minimally invasive procedure called a uterine fibroid embolization. To go over the options, hysterectomy means going in and taking out the entire uterus, which is considered a major surgery. Because your uterus is removed, you're no longer able to have kids, and because it's a larger procedure, it's associated with high risk of bleeding and a longer recovery period, which may be months. A myomectomy is an invasive procedure. It's a surgical procedure where the surgeon goes in and cuts out as many fibroids or parts of the fibroids as possible. However, this may not be a good option for patients who have multiple uterine fibroids because a very high percentage of myomectomies actually become hysterectomies. They get converted into hysterectomies because the surgeon feels that there's too many fibroids to take out. Again, since it's an invasive procedure, it's associated with a higher risk of bleeding and infection. The third option is a uterine fibroid embolization. A uterine fibroid embolization is a minimally invasive procedure where we go into the blood vessels through a very tiny incision and we stop the blood flow to the uterine fibroids. Because the blood flow is stopped, these uterine fibroids immediately die off, and we can take a uterine fibroid that is the size of a grapefruit and shrink it down to a pea size. Basically, the most important part is that there's a 98% success rate with this procedure, so that 98% of women report complete or very significant relief of their symptoms, and they're able to go back to their normal lifestyle. Another huge plus of this procedure is that it allows you to retain your fertility. So most women who have a uterine fibroid embolization procedure in appropriate age can go on to have a successful pregnancy. All three of these options are considered first-line therapy, meaning a hysterectomy, a myomectomy, and a uterine fibroid embolization can be offered to a patient as first-line treatment for the treatment of uterine fibroids. And this is recommended by the American College of Gynecology, which is the governing body that makes the guidelines for treating uterine fibroids.